The gift of care, navigating healthcare systems. First things first. When in doubt, call for immediate help through either 911 or a government community nursing doctor telephone line, where a professional can guide you on whether you need to go to a hospital or not. In all other situations, let's look at how to navigate the healthcare and other systems. Let's give an example of a single mother who has a child with a disability. The mother finds out that she has cancer, and she is involved in a child custody case with her husband. She is exhausted, she's overwhelmed, and she needs help from the following systems: healthcare to deal with her cancer, government income supplement department to deal with her financial concerns, education system to deal with her child's education, 2 community agencies, one for after-school support for her child and another for transportation to get her to and from her medical appointments, legal aid to deal with the custody case, and the housing authority to deal with housing issues for her and her child. In all of those systems that she's involved in, she needs to concentrate on 4 primary goals of navigation. The first, obviously, is to navigate the systems. The second is to negotiate the best support and care possible in those situations. The third is to mediate any problems that arise. And the fourth is to reduce stress on all the caregivers involved, including herself, her family, any of her friends who are helping, professionals, and volunteers who may be involved in any one of those systems. In that navigation process, she needs to think about all the different possibilities that she may encounter and talk to people that she trusts about what might be best for her and for her child in these circumstances, to plan the supports that she may need. And the last module in this series of modules looks at creating that support circle for her. And the last is to practice whatever skills she needs to improve her communication skills, taking notes when communicating with people in any of the systems, research and organizing information that she needs, and possibly even time and stress management. For this woman, she is dealing in an overwhelming situation, and so the faster she finds 1 or 2 people that can help her navigate through the process together with her, the easier the whole process will become. The underlying philosophy of this process is that we never replace the natural supports with systemic ones. In other words, it makes no sense to go through this process with someone in a professional capacity who may change, who may go on vacation, who may switch shifts or switch departments in the organization. You really need someone who is on your side, loyal to the information you need and to keep that information along with you. As well, care providers in any one of those systems will not know much about what's happening in other systems. So your doctor won't know anything about the housing crisis, the custody case, those things. So you really do need someone, family, friend, neighbor, colleague, who agrees to support you through this process in a natural way and who won't go home at the end of shift. There are resources for information and services, and we divide them into various categories. So, for example, on the top left, you see people you know. So these are family, friends, neighbors, co-workers with specific knowledge and skills that you can rely on. There may be professionals that you know and their staff. Often a doctor's receptionist has an immense wealth of knowledge of how to navigate the health care system. People that you do not yet know would include professionals and their staff, bureaucrats, elders in the community who have a wealth of information services like 211 or 311. And so ask colleagues, friends, anyone in that first column of people that you already know, who you should be speaking to find out the information you know to get the best care and supports you need. And then sometimes it's just the stranger you meet on a bus or a train or waiting for a bus service or at a restaurant or anywhere where you might frequent. Often if you just sort of start a conversation, you will be amazed at how many people have contacts that they're willing to share with you to help. The second column looks at websites, sites that you can trust and go to find, including blogs, general websites, disease-specific websites, support groups. Some that are particularly helpful, one is called drugs.com, which is a general dictionary of drugs and their side effects. There's the mayoclinic.com, which is a highly trusted consumer patient-oriented type of website, also for professionals, but also for patients and families. Very simple to understand information about all the different kinds of conditions, diseases, processes that you might need to go through. There are also government healthcare websites, disease-specific websites, and patient groups. To verify any unknown sites to see if they are trustworthy, you can type in the site's name in the browser and then add the word critique or complaint beside it to see what others think of the information and where it may be lacking. The next column looks at books and magazines, ones that you, again, can trust, that you know are reliable, as well as bookstores and libraries. Librarians and bookstore sellers, many of them have an immense wealth of knowledge and information that they're willing to share with you. And lastly, organizations that were designed to help patients and families, whether they be libraries, online chats, disease-specific organizations, where you can just walk in and ask to speak to someone and get some help. The next steps. You need to choose priorities. You can't do everything at once. What will make the greatest impact first, second, and third? And then you need to take notes. The contact information of everyone you talk to and a summary of what you discussed and agreed upon. This comes in very handy a few months later. The other side may very well not have taken notes, and so your notes will act as a summary of what you discussed. Schedule appointments on a general agenda calendar to keep them straight. Try not to sort of split different calendars for different purposes, because you'll lose a sense as to what you may have scheduled at 10 o'clock for two different people or two organizations. This includes times with professionals, but also time for family and friends, and just time for yourself. Delegate tasks. One family member can be in charge of communication with the rest of the family, so you don't have to do that. A friend might be the person who is very good at adding items to their shopping list that you need, so that you don't have to do that shopping on a weekly basis, the staples. And then you need to communicate with the people who need to know the information. If you've delegated the task of one person talking to the rest of the family, then you need to inform them of what they need to share with others, for example. And lastly, share what you learn with others, so that this is not such a lonely process for them or for you. I've created a website called navcare.org, and on this website are 7 downloadable free books and manuals on how to better navigate healthcare and other systems, how to negotiate the best care possible, and mediate problems as they arise. These 7 downloadable books in PDF format will allow you to pick whichever is most relevant to you. You would start with the pocket guide, which is the red cover on the left, top left. You probably don't need the textbook, which is for universities and colleges to create courses in this, but one or two of the others might be a good way to start. Many of them have just blank forms in them, like for going to the hospital, communication things, as well as how to organize all of your medical, legal, financial types of information in one place, so it's easy to find when you need it. So navigation, when you're not sure what to do in emergencies, call 911 or the local services that we've discussed before. But for all other ones, consider how best to navigate, negotiate the best care and services possible in the circumstances, because you can't always get what you want, but you can often get around what people aren't offering by being somewhat assertive and pleading your case. How to mediate problems that arise and reduce stress on caregivers generally. And then think through the process. If you're taking this program at the beginning of your caregiving journey with a family member, then think what is likely to happen, what's possible to happen. Talk with them and others about what to do in different circumstances and plan for those circumstances. And then practice, especially the practical skills of providing bed care, for example, or helping someone with mobility issues, or helping feed someone who's having difficulty for a while feeding themselves. Try never to replace natural supports with systemic ones. If a neighbor offers to help coordinate some of the care, don't replace them by hiring someone yourself or using one of the community services planners, because again, the neighbor is there on a more regular basis, is keen to help, and will keep track of not just one system but all of the systems that you need support with. Go to resource people you know and don't know yet, and websites and organizations, books and magazines to find the information you need. If you are overwhelmed yourself, then delegate this as one of the tasks to someone else in your family or circle of friends so that they keep up to date with possibilities. And lastly, navcare.org, where you can download free PDF books and manuals on how to better navigate the systems. These are much more detailed than we are able to do in the 11 short minutes we have here, but they are free to you and you can use them however you wish. Our next module will look at how family and friends who are visiting can be more helpful. See you soon.